Italian skiers are back on the slopes, in a place that last year was the epicenter of the pandemic in Europe. As COVID-19 ravaged northern Italy, the country took tough measures to stave off disaster. Now, as case numbers are spiking in neighboring countries, Italy will place more restrictions on unvaccinated people.
We want to hold on to what we have achieved, what Italians have achieved over the past year.
What lessons can Italy teach us about dealing with the coronavirus pandemic? Welcome to your COVID-19 special. I'm Chris Colbert in Berlin. Last year's dramatic pictures and Europe's second highest death toll linked to COVID-19 seem to have had an impact. Italy already has one of the strictest anti-infection regimens in the world, and with cases rising again, the country is now barring unvaccinated citizens from much of public life.
Time for a booster shot. An invitation message is sent to all those who qualify for one. Italian care home staff, teachers and high-risk groups got theirs first. Over 40s are up next.
Fortunately, there's been an effective vaccination campaign in Italy, which is not common. The fact so many people have been vaccinated is good for everyone. It's also important that each of us pay attention to where we go, that we always wear a mask and we keep our distance. All these factors, along with vaccinations, have contributed to controlling the number of infections in Italy.
On public transport, only those vaccinated, those who've recovered from infection or who've been tested are allowed on board. The same goes for workplaces. Companies that don't check for a so-called green pass face fines, and employees without it could have their pay cut. People must pay for their own coronavirus tests in order to push more Italians to get vaccinated. In recent days, the number of infections has risen in Italy, but there are far fewer seriously ill people compared to a year ago. Only 475 of 9,000 intensive care beds are occupied. Italy remains optimistic as winter approaches. Only those vaccinated, recently recovered or who've tested negative are allowed on the country's ski slopes. But Italy is hopeful that Christmas can be more relaxed than last year.
Let's take a closer look at what Italy has been through and which conclusions we can draw from that, together with Walter Ricciardi. He's a hygiene and public health professor, and with the intensive care physician Enrico Storti. Buongiorno, signori. Welcome to both of you. Enrico, let me start with you. How hopeful are you that you and your colleagues will have less to do over the holidays?
I think that we can say that now the situation is completely different compared with what we experimented last year. I mean, we have, of course, the virus circulating in our country, but thanks to the vaccination protocol that Italy decided to carry on, I think that now the impact on the hospital and on the ICU, particularly by my perspective, is much more easier to be controlled. And so our daily practice is absolutely better compared with last year.
Walter, over to you. More than 2 months ago, Italy imposed some of the strictest anti-COVID measures in the world. Practically all workers in the country needed to show proof of vaccination, recovery, or a negative test to get to their job or lose pay. Now, starting Monday, the country's Super Green Pass will basically bar unvaccinated citizens from much of public life. Why?
Because we learned the lesson that this virus must be anticipated and not followed. And the Delta variant really changed the game. So we understood that only with very strict measures we could anticipate the spread of the virus, and we could avoid the situation of having a country that had to be locked again. So essentially, this is really the situation as it is now is much better compared to other countries because we advanced these measures, not follow them.
How have people been reacting to this new rule, Walter?
After all, very well. I mean, you know, the vast majority of the countries is following the rule. I would say more than 90% has been vaccinated, and more than 90% is following very strictly the rule. There is a tiny minority which is very noisy, unfortunately, and with some media generating a lot of anxiety in the country because of this tiny and noisy minority. But after all, the countries is behaving.
Enrico, back to you. You said the situation today differs greatly from the one last year. Nevertheless, we see infections rising, not only throughout Europe, but also in Italy. How worried are you about new variants occurring like Omicron?
As Professor Ricciardi already said, I think that we did our best to be ready and to get ready about this new spread of the different virus, different types of virus. And of course we are worried, but I think that now we have to better understand exactly what are the characteristics of this new variant, and basically starting from what we know now, I think that we can say that is a sort of it's powerful in terms of capacity to infect. But we didn't know exactly if this characteristics is able to sustain a different impact on the illness itself. So I think that we are ready. We are now trying to do what we can actively do, and we are still doing that. So we are not worried, but of course we have to be very careful about what is going on.
Walter, back to you. With more than 130,000 deaths linked to COVID-19, Italy has the second highest death toll in Europe. We've seen the pictures of coffins being stacked onto army trucks. How much have these images had an impact on the public and their behavior during the pandemic?
They had an impact, absolutely. They really shocked the country, and they made all the people aware that this was not an ordinary flu. This was a serious disease to be taken into account, particularly because the first wave struck the best part of the country, the most developed, the richest, the most equipped. So we were shocked, and people understood that this was serious. Unfortunately, the second and the third wave, we underestimated the importance of keeping these measures alive, but now we have learned the lesson.
Walter, what needs to be key for Italy when moving forward in this pandemic?
We believe, as Dr. Storti said, that vaccinating is still the most important pillar of action, but not only. We have to keep a safe distance. We have to keep universal masking. We have to keep hygiene. We have to be very careful in mass gatherings. So the combination of the measures is the only way to manage this pandemic, and we are going to do that.
Enrico, back to you. Even with all the precautions, some people will end up being hospitalized. Now, at the beginning of the pandemic, treatment was scarce. How well are you equipped today?
Let me say that I think that we can say that we now better know this infection, the direct consequences that this infection is able to bring. And so I feel myself, and I can tell you that all the ICU community physicians in Italy, we feel ourselves confident that we have all the tools that we need to control this illness. Unfortunately, I think that in the near future will be important trying to get some drugs. And not only how to ventilate and how to preserve the patient's lungs to have a better outcome of this infection. Let me say that if we compare now our treatment, compare with what we did and what we can do at that time 1 year ago, I think that now we have a much more concrete standard that I think it's really enough to treat these patients.
Intensive care physician Enrico Storti and public health professor Walter Ricciardi. Thank you to you both. Mille grazie, signori.
You're welcome.
And now it's time for another one of your questions. Here's our science correspondent, Derek Williams.
Can you tell us more about the effects of long COVID in kids?
One of the few upsides, if you will, of SARS-CoV-2 is that at least during the active infection, children are largely spared serious outcomes like hospitalization and death. But that doesn't mean that some of them won't eventually pay a price. Estimates for what percentage of children suffer symptoms associated with long COVID in the weeks and the months following an infection, they're kind of all over the place. But most researchers in the field seem to agree now that it's significant, although recent data indicates, thankfully, it might not be as common as we once thought. Some early research postulated that post-COVID symptoms might affect up to half of all the kids who got it. That estimate has dropped considerably, with a larger recent study roughly finding more like 1 in 7 kids are still reporting symptoms over 3 months after a COVID infection. Just like in adults, those long COVID symptoms have also been very wide-ranging in kids. The most serious reported effect is called multi-system inflammatory syndrome in children, or MIS-C, which can lead to organ failure. It's fortunately pretty rare. There have only been around 5,500 cases of it reported in the US so far, for instance. More common effects are sometimes, but not always, similar to those reported by adults, like fatigue or labored breathing or headaches or changes to the sense of smell and taste. Neurological symptoms like brain fog or difficulties concentrating are also widely reported. Some studies show that vaccines appear to help cut the risk in an adult of developing long COVID if they experience a breakthrough infection, maybe by as much as half. But there isn't enough data yet on whether they also reduce the risk of it in younger kids. We just haven't been vaccinating them long enough to know.
And staying with vaccines, the Oxford AstraZeneca jab has been credited with saving millions of lives. But some countries suspended its use after an extremely rare side effect was reported that may cause blood clots in some recipients. Now, researchers in Britain and the United States may have found what causes the clotting. A protein in the blood is attracted to a key component of the vaccine, causing a chain reaction with the immune system. AstraZeneca scientists took part in the research and say they are looking at ways to eliminate this side effect. That's our show for now. For more information, check out our website at dw.com/COVID-19. I'm Chris Coburn in Berlin. Thanks for watching. Stay safe.